Head and neck cancer can be very difficult to treat, with risk of radiation damaging the brain or spinal nerves. Dr. Nisar-Syed of Orange County CyberKnife explains the best options for patients facing these diagnoses.
What they mean with the head and neck cancer is the cancer is starting from the lip all the way to the upper part of the esophagus. All the structures like mouth, the tongue, the throat, the voice box, which is the larynx, the hypopharynx, and also the certain areas like antrum and the sinuses, which are right behind the nose. So all inclusive, and the parotid glands. They are all part of the head and neck cancers.
What are the symptoms of head and neck cancers?
Most common, let's say, the sites of the head and neck cancers are in the oral cavity. That means like on the tongue, under the tongue or throat. The symptoms are mainly initially they may have some soreness and they think it's just like a little ulcer. And then when it grows, it starts to cause more pain, discomfort, and then difficulty in swallowing, even some bleeding. And when the tumor is pressed to the areas like to the neck, then it starts to show a mass on the neck with the pain and discomfort, loss of weight, speech problems, etc.
How can head and neck cancer be treated?
In the head and neck cancers, these are the very critical structures. Like if you have tumor on the tongue, patients have to speak and swallow. If you do surgical removal, they cannot swallow, they cannot speak, they cannot function. So as a result, you need to treat them. External radiation alone oftentimes cannot eradicate the tumor. The reason you have to give so much radiation to the tumor that the surrounding structures like the jawbone, the spinal cord in the back may get over-radiated. So as a result, you combine the external radiation to a limited dose which is tolerated well by the tissues and less to the surrounding tissues, and then you boost that either with brachytherapy, which is putting the radioactive sources directly into the tumor, or using stereotactic radiosurgery by CyberKnife, which is a relatively new technology which seems to be very effective. This CyberKnife is a very small linear accelerator which is on a robot, and the robot goes around the body by the computer control after very sophisticated computer treatment planning. And while the robot goes around the tumor, it takes the pictures and you adjust the position of the beams so that the tumor is not missed by the beams and we do not treat the surrounding tissues as much.
We ask about the success rates for CyberKnife treatment.
This is the most sophisticated radiation treatment we ever had. With the accuracy, with the intensity, you can treat the tumors, both initially like a primary treatment, as well as when the patients already had other treatments but recurred, which were untreatable in the past. Now we can address those tumors. They are doing great at the present time. The follow-up is short but very encouraging.